Tuesday morning here at Horse Plus. We have a busy day on our veterinary schedule. We've got 3 equine castrations scheduled. This is Chocolate Chip, he's our first one. I think he's about 7 or 8. He came in through our buyout program. Week before last, just pouring banana pudding. He's responded really well to treatment. His respiratory rate, effort, nasal discharge have all wildly improved, and his CBC was good enough that I put him on my surgery schedule. We are moving him to a different quarantine pasture. I love doing surgeries outside. Horse Plus has a beautiful inside surgery room that we'll be using later today, but for this horse, we're gonna castrate him out in this big grassy pasture. It's the perfect day for this. It's like overcast and like 70 degrees. So couldn't be a better day to do castration surgeries. He only needs a castration. Our next 2 after this are those cute little inbred paint boys that both have hernias in their body walls. And one of them also has a wound repair and a dental extraction and a bunch of other stuff. So this is our most straightforward surgery, although surgery is never straightforward in horses. Anesthesia is always a risk. So I already started our anesthesia protocol. There's gonna be 3 different injections. The first one goes in the muscle. He's already had that one. We wait 10 minutes. The second one is in a vein, and that's 2 different drugs, an alpha-2 sedative called xylazine and an opiate type pain medication sedative called butorphanol. And then 10 minutes after that, we give our induction agent, ketamine, plus a benzodiazepine called midazolam. And so those drugs together make a really nice, smooth anesthetic experience for the patient. With horses, they don't read the textbook, so sometimes things don't go according to plan, but we've got Cody helping us and Sydney helping us, and then it's me and Nicole. So but that's our plan for today, and we're gonna walk out to where our patient is. Just finished castrating Chocolate Chip. He did great. Anesthesia was nice and smooth. Sydney, our wonderful equine coordinator here at Horse Plus, is in classes to be a veterinary technician. So I'm teaching both her and Nicole kind of more ins and outs of equine surgery so they can do a better job assisting other veterinarians. So we talked through a lot of anesthesia monitoring and drug protocols and what we're doing and what stuff we need when. He was a great learning case. He's a little bit older, so his testicles were quite large and he's got a lot of blood supply, but the weather could not be more perfect. The anesthesia went perfectly, and I love to recover them, you know, in a big grassy field. So we're gonna keep an eye on him from afar, and we are moving down. Our next surgeries we're doing inside in our equine hospital because both of them have body wall hernias. One of them, I'm 100% sure small intestine is coming in and out. We're gonna start with a slightly easier one. And he also needs to be castrated. So it will be the surgery we just did for this guy plus a much more involved, much more complicated surgery to close that body wall. We're doing the body wall first, but we don't want to risk contamination from the environment getting near or in that surgery site, so we're doing him inside. And he just took a big deep breath. That's exactly what we want him to do. He's starting to wake up. There's a big hole right there. It's like a trench. I keep falling in it. Batman, you look great, sir.
Good morning, Peyton. So who do we have here and what are we working on?
So today we have Gambler, and so pretty much we have a saddle and a saddle pad on him just to get him used to like being under saddle. We haven't ridden him yet, but we're just trying to get them used to like the weight and just stuff being on their back. So we put the saddle and everything on him. I went ahead and I started like with the hula hoop, just like shaking it around because he needs work on desensitizing a little bit more because he is scared of a lot of stuff. So I just took the hula hoop and took the flag, just swung it around his face, everything. So he's not scared of it. So we're getting them used to everything over here. We took the tarp because that is not his best friend. So we took the tarp, I drug it around a little bit. He is still sidestepping a little bit, but he has come so far because like the first time I had the tarp, he sidestepped the whole way. He did not follow me. Also, he has come a long way because when I first worked with this guy. He would not let me touch his hair. He would not let me touch his face. He would not let me touch his nose. He's just come a long way. I love this guy a lot. He is a little bit older guy, you know, but he's still like a baby to me and everything. So yeah, we're working on the tarp. I got to be able to put it on his back, and he was able to lead around and everything. I lunged him with that. He did so well. Like, I'm actually really proud of this guy and everything. And one thing that me and Cody love to do is when we're training these horses, it's always about like the connection and everything. And we also love to end on a good note. So what I ended with was the tarp, and he did pretty good. He actually stepped on it. Like I said, he was leading and everything. He did real good. So I wanted to end on that good note. And he's been such a good boy. Like, look at his face. He's like, oh my gosh. So yeah, I am so proud of him, and I can't wait for him just to progress and everything. But yeah, so that's what we have going on for today.
We just finished up Whiskey's surgery. It really couldn't have gone better. So if you donated to, thought of, or prayed for him, thank you so much. I'm really thankful we did Echoes first because we positioned him completely differently and had a couple different supplies set up. And so this hernia repair actually, in my opinion, went more smoothly than the first one, which was much smaller. I don't think we had any contamination from the outside to the inside of the abdomen, but opening the abdomen always opens you up to risk. So I feel good about that. We were able to get it all the way closed. I closed 3 separate layers. I did have to take some scissors and remove a little section of body wall because your skin won't heal to other skin if it's not injured, right? So I created an injury so that the body wall can heal that way. His castration also went seamlessly. He did have 2 testicles. They were very tiny. And sometimes people are critical of early castration, but in this case, he was already under anesthesia. So he doesn't have to go under anesthesia again for the purpose of castration. His incisor extraction went beautifully. Nicole pulled it. I just kind of told her what I wanted and talked her through the thing, and that tooth came right out. And the wound on the inside of that left front leg that she sustained in the trailer on the way here is also healing up beautifully on its own. So really all we did today was clip, scrub, and put some wound ointment on that. So as long as we don't get an infection, and as long as the sutures that I put in place with these guys hold long enough that the body wall heals back to itself, we're in the clear. So we're not completely in the clear yet, obviously, but everything went really well. Our first castration today was just a castration, and he went great too. So yeah.
All right, Lynn, so I hear we had a concerning call that came in about the members video.
Yes, today we had a call come in concerning a members video on the investigation on horse meat. We received a call today from someone concerned about the members video about the investigation of the horse meat. They were a little bit confused on what's going on with it. Now we are able to talk about it.
So this is lahasi, and it is a dish that's sold prevalently to the public for human consumption. And that is horse meat mixed in with some other things. The horses are being butchered in the United States, and their meat sold for human consumption. It's just so disgusting.
For months now, we've been conducting a multi-state investigation into the illegal black market sale of horse meat for human consumption. It's thought, that horse meat is being consumed in other countries, or maybe in Florida horses are being stolen and butchered, but through this investigation that we've been doing as part of the Horse Slaughter Pipeline Project, we have discovered that there is a black market for illegal horse meat being sold for human consumption. I just got back from doing investigative work and purchasing horse meat. Now I am vegan. I don't buy meat, and I had to go and purchase meat. It's being sold out of food trucks. It's really just horrific. But we've been purchasing meat. We've purchased it in multiple states. We are able to get DNA testing to confirm that yes, indeed this is horse meat, or it's horse meat mixed with beef. So at auctions, if you can go to an auction and buy a horse for $200, $300, $400, and cows are selling for $800 to $1,000, and you're running a food truck and you need meat, you can do the math. So we have been investigating this, went out and purchased some horse meat. I mean, basically just had to find the right person that was selling it.
I'm here for the Nate's Lhasa, 3 plates.
Horse meat is not intended for human consumption. Number one, it's toxic. The AVMA, the American Veterinarian Association, has found that horse meat is toxic. So no matter what it tastes like, antifreeze is supposed to taste really good too. Doesn't mean you should eat it. It's toxic. So horse meat is toxic. It's being sold to the American public. And all this investigation comes down to that this is happening within the United States. And, you know, going deep undercover, you know, I clearly do not look like myself when I'm deep undercover. I've been doing undercover work for about 18 years now. You know, there's been an arrest in California. There was a guy that was an auction owner that was shipping horses to Canada. And I was undercover and with the news pointing everything out of what's going on. Done undercover work for a long time. So went undercover again last weekend as part of the Slaughter Pipeline project. And we need donations to fund this investigation to shut it down. There's a lot more going on that we'll be releasing soon. In the members videos, you'll see little tidbits of it. And it's pretty horrifying. We did go around to all of our staff to let them smell it. Another investigator that worked within a slaughterhouse for horses trying to get it shut down years ago commented to me that horse meat has a very unique smell. And, you know, I don't eat meat, but I definitely picked up that it was a very unique smell. So we did take it around to our staff for them to smell it and kind of give their feedback on what it smells like. Some staff said it smelled kind of like a venison-y type smell. Others said that they wouldn't have known. Like it could literally they could have eaten it and not known. So, you know, I was kind of hoping that it was so distinct that for people that are used to eating meat, they would know if it was horse. But the fact that they don't know, like from the smell, that it could be horse is kind of terrifying if you eat meat, because we are getting DNA samples that are equine and beef confirmed mixed together. So if you're going to a food truck, you could literally be getting horse meat and not even know it, or it's mixed in with beef. So just over this weekend, lined everything, went out to you know, food trucks, went to actually people's houses where they are selling it, and did purchase samples. So those samples are off to get DNA testing just to confirm, but it was sold to us as horse meat. We'll continue this investigation, but we do need support to keep investigations like this going. You can't just, I mean, it's probably easier to buy drugs off the street than to buy horse meat if you don't kind of have the right persona of someone that they think would be wanting to eat horse meat. So definitely keep our investigations going. I mean, this is just a small part of the investigations that we have going right now, but horse meat is definitely being sold within the United States. Horses are being butchered for human consumption and their meat taken across state lines. We are working with law enforcement on this, but the thing is, it might be a slap on the wrist. It might be like, don't do that anymore. We need the public outcry to come forward and say, there's horse meat being sold. This is not okay. And I've said this countless times when somebody's like, you know, there's this horse that animal control is not doing anything about. It's not until you go to the news when people learn about it, that something happens. So it's time for everyone to stop living under a rock and realize that horses are being purchased at auctions in the United States to be slaughtered within the United States for human consumption. And this has got to stop. The SAFE Act would put an end to this. It would make it federally illegal. What this horse meat it's illegal because it's not USDA inspected, and it needs to stop. So we'll continue the undercover investigations, and please support us as we, rescue, shelter, and protect horses. This is part of the mission of what we're doing, is to shut this down. So please donate, and please be wary when you're at food trucks that the reality is horses are cheaper than cattle at auctions.
Oh, you're so smart. Okay, let's try this. Good girl. Good job. That's great. You want to just hang out here now? Okay. So this is Misty. She is one of the Mustang mares that we have here at Horse Plus. She is halter trained, but kind of barely. She injured herself on Tuesday in a chute in our training barn. And this is where I'm really thankful that we have staff, that we have vet staff, because we were able to assess her pretty much immediately after she got injured. And she harpooned herself pretty good on, we have swing gates with kind of like a little bar that closes behind, and she tried to go through and then she tried to back out. So she has a perfect hole punch in her right shoulder. I'm actually really happy with how it's looking. So she had some significant bleeding, including arterial bleeding at first. We did do x-rays. We didn't see anything broken. We saw a lot of gas. So she really had gas probably at about 8 or 10 inches of depth. But my hypothesis was that she tore her muscle, not that the gate actually went in that far. And initially she would barely move. She's walking really well. We were able to do hydrotherapy yesterday, but I want to get her in our stocks so I can kind of probe it and do a little bit more today. We're going to do some more hydrotherapy, but I am cautiously optimistic that we kind of avoided worst case scenario in this case. And also, she's a young Mustang, so providing care without making her more fearful of humans. And obviously a gate hurt her, right? So getting her in the stocks today is like, we don't want to create additional trauma. We want to be respectful of the trauma that she experienced. You also can see, so this mare hasn't been with us that long. She's got a really big scar across her forehead. So this happened prior to coming to us. It's kind of funny as a veterinarian, if you get a call from a farm, like, oh, we got a horse that has a laceration. It feels like it's always the same horse. Some horses are just a little bit more accident prone. So this one's healed up really beautifully, but we started off with our kind of standard sedative, which is an alpha-2 sedative called dormocidin or dormicide, depending on where you're from. And she still was really fearful, and I want to be able to really do a thorough exam and get this well cleaned today. So instead of giving her more of a sedative, I gave her butorphanol, which is an opiate type pain medication with sedative side effects. So when she injured herself on Tuesday, I gave her the same drug at first, and she still was like shaking and not responding. She had got additional pain meds on Tuesday and yesterday and today as well. So instead of making her sleepier, I want to make her more comfortable. And sometimes using a little bit less of multiple drugs is a better choice than using more of one drug. Because there's no way that pain isn't a significant variable in this case, right? Like she just really hurt herself. It also lets us desensitize her a little bit. Like if she goes back in her stall and she's like, man, I feel awesome. Horses are smart enough to recognize, intention, but also they can make connections with like, I did this and it hurt me, or I did this and now I feel better. See, sometimes I'm the drug lady. I'm the drug lady. Dr. Scott one time years ago, used to be the vet here. Everybody calls him Doc. years ago, Doc drove a Porsche. This is way before I knew him. And so he was with his wife, and he got pulled over somewhere outside of Hohenwald, right? So if you're in Hohenwald, everybody knows Doc. So he gets pulled over, and the cop goes, "What do you do for a living that you can afford to drive a Porsche?" And he goes, "I sell drugs," which technically is accurate, right? Like if you're a veterinarian. And his wife smacks him, and she's like, "He's a veterinarian, he's a veterinarian." So anyway. Yeah, it's okay. You can look at me like that. Good girl. This does a couple things. Number one, the coldness is going to pull out inflammation. So inflammation is a component of the body's response to being injured. Whether you strain something, tear something, cut something, inflammation is going to happen. So the cold is helping pull it off, but the pressure of the water, even though it's really subtle, is also kind of massaging the tissue underneath. And if you watched earlier, I just kind of like gently ran my fingers down. Obviously, this is a very painful part of her body right now, so I'm not pressing hard, but what we want is for all of the swelling and drainage to come out the existing hole so that we don't end up with a pocket of infection that we call an abscess. So hydrotherapy is an amazing way to care for your pet. I always tell people to be careful with hosing directly because some people will want to take a hose and like shove it up in there. Water is not at physiologic pH. So it actually can be irritating to tissues that should be protected by the skin. Not irritating to skin at all, but parts of the body that should be inside actually don't like water. It can irritate tissue. Obviously, we use it all the time, but if I have a really, really sensitive wound, I'll often clean it and then I'll lavage it with lactated ringer solution or sterile saline or something that is closer to the pH of what the body likes to have. Those things are really carefully pH balanced because they're designed to be put into circulation. So they're very safe. We can't do a whole lot with her, but we also don't want to push it because I need to provide her with daily care until this is healed. I can't make a big hullabaloo and have her be like, "Oh, I'm not going to let these people catch me again." So that's what we're doing. All right, I'm going to be really surprised if this is successful. Maybe we'll be pleasantly surprised. So I'm going to use the water as a desense, and I'm going to run it over while I try to place this catheter up in there and flush. I know, you're all right. Okay, good girl. Okay, I'm happy with that. We can be done with that. Sydney and I just finished up doing her treatments this morning. She got some hydrotherapy, just some cold water run over her right shoulder and leg. We cleaned the whole leg. I used some betadine to flush out her puncture wound. And then we put wound ointment, anti-inflammatory cream, petroleum jelly down the leg, and just some fly spray on her. And then I got to play with her hair for medical purposes. Her mane is long and gorgeous and long enough that the hairs touch where that puncture wound is. So we braided it up better. We're going to try to find a hair rubber band because the fat wrap in the forelock is terrible. But I'm cautiously optimistic that she's going to do well with this. I am going to change up her antibiotics today. So instead of another Exceed injection, we're going to put her on Uniprim, which is a sulfa drug. It's trimethoprim sulfas. So she's going to get oral antibiotics instead of injectable antibiotics. And she is going to stay in our hospital through the weekend. And we'll keep you posted. All right, you guys. Hi, handsome boy. How you doing? Oh, you need a bath. What have you been getting into? He has like pine sap on his face. Hi, you good boy. Good boy. Oh, you're so perfect. What a wonderful sir. So this astute gentleman behind me is Sheldon. He is gorgeous and a very good boy. So he came through our buyout program in July. Can't believe it's already August. He is down today for a dental. His dental radiographs look pretty good, but he has some sharp points in the front that I'm gonna reduce, and I always try to palpate everything and make sure we know what's going on. So he got a little bit of a sedate. Sheldon is blind in both eyes, so he can't see at all, but his eyes aren't painful, and he doesn't have entropion, which is that condition where the eyelids roll in and rub on the corneas. So he actually doesn't need to have his eyes removed, and he's in his mid-20s. So if he were 5, I'd be taking those eyes out, because over time, as they start to get smaller, you can develop problems. But I love his eyelashes, they're so cute. So he's just getting his teeth checked today, and we're also gonna give him a bath. I think he's been rubbing on those pine trees. He's got pine sap kind of all over him. So we're gonna clean his sheath and give him a bath and float his teeth today. And then after that, we're gonna recheck Tonka, our abscess boy. He's a good boy too. I'm surprised he's not up here. He probably like ate breakfast and took off. Peyton and Sydney, I will warn you, I have really bad aim, so I'm probably gonna get you guys both wet today, and I'm sorry in advance. I absolutely adore this thing. It is way safer. It's still heavy, but it's way less heavy than the last one.
Okay.
So when I say weaponizing the head, when you put this thing on, they move it all and they're gonna clock you with their $3 sunglasses. No. So I usually take the halter off, and especially with him, with how big his head is, he can't open his mouth with this halter on. So then we make it just about big enough, and now you just act like it's a bit, right? And just try to get that in. Sometimes if they're really sedated, they'll bite their own lip, so I always watch their lips and make sure they don't bite. Beautiful. All right, now lift his lip up. You want those teeth right up against the front. See how that's right up against the front? You want that top and bottom.
Got really good teeth, sir. You're not very sleepy, are you?
On the lower left, he's got some sharp ridges on that lingual occlusal surface. He's got a big point in the front on his upper right. And he's, same thing, little ridge of sharp points on the lingual surface of the lower right, but nothing horrible. I don't feel any teeth moving. Yeah, right? And then feel the teeth behind it. That's how they're supposed to feel. So they are bumpy, right? Like they're not super smooth. You want some pattern there because that's how they grind their teeth. I don't want to make this a big thing and hate on lay dentists, but if you hire someone to do your horse's teeth that is not a veterinarian and they don't know what ridges are supposed to be there, you can cause major damage. Yeah. Okay, y'all stick your hand in and feel that one. I can't get it all the way to the top because I don't want to hit the gum, but see how much smoother and less pointy that is? So he can close his mouth now. You guys, this is my favorite day. Bath day is my fave. What do you think about the hose? Oh, good boy. Oh, you guys, this is so satisfying. I really like this shampoo.
Look how gross you are down here, sir. When's the last time anybody bathed you?
Man, this is bringing it back. One of my favorite jobs ever. When I was in college, I got a job driving horse carriage tours in front of the Chattanooga Aquarium. And I had to like soap bath these horses' legs before every shift. But man, it was a fun job. And these horses, right, like they do the same loop 50 times, so they really don't actually need you to be there. They just drive themselves.
Gosh, Lydia, you have lived like 8 lives.
I'm old, Sydney. Oh, we need to do your face. What a good boy. I sure hope you let us rinse this off because I just put a lot of soap on there. You guys want to spread out to find him?
Yes.
I'll take the far left corner.
You're my favorite buddy. Can Tonka have a treat?
Yeah. Do you guys remember how lame this horse was? He was almost on weight bearing, so he's a little off still, but he honestly looked off in the front end, not the hind end.
All right, let's go.
I'm just gonna watch him walk while you guys bring him in. Sound at the walk. I'll take that. Tonka's abscess looks phenomenal. I'm so happy with how it looks today. We had an opportunity to see him trot out in the field. He's a little bit off still, but he's improved by 4 lameness points on a 4 out of 6 lameness scale. So that's pretty darn great. He still has a little teeny tiny soft spot in that left hind foot, and so we put some treatment on that, but I'm very happy with how he looks. He did have 2 choke episodes, which we never want, and his teeth really weren't the problem. I think he just has been so calorie restricted that he bolts his grain. So he's getting soaked grain. We're really watching him closely, but the first 10 or so days after choke is when you really worry about them choking again. And we're almost at the end of that period of time without any more choke. So we're happy about that. I actually am not gonna turn him out until he's like a little bit more awake because we don't want him to re-choke again, but grass is the best thing for choke. So we turned him out in our 10-acre pasture where he's got most of his calories just from fresh grass, which is really ideal for refeeding anyway. So I'm hopeful for him. He's a very good boy, and we're about to turn him back out and go down and eat lunch. I wanted to give you guys a sad update on Remus. He is one of the horses who came in through our June buyout program. Dr. Gina and Nicole did his initial intake exam. I rechecked him last week and had some concern. So we were hopeful that we could clear him to enter general population last week because he was all the way in June, should have been cleared in July. Now it's August. He did have a little bit of a fever at the time. His lung sounds sounded worse. I was thankful that we had Nicole because she listened to him on his intake. And so it was the first time I had examined him myself. And Nicole agreed she thought his lungs both sounded worse. He had not gained much weight despite our refeeding him. And our staff continued to notice that there were a lot of times that he was laying down. So horses can sleep standing up. There's something in their pelvic limb called the stay apparatus. So they can kind of like pop their legs into place and sleep standing up. But many horses do lay down to sleep. This guy was sleeping more than was normal. So we were watching him pretty closely. We also did a more complete neurologic exam on him, and he passed his proprioceptive placing tests, which means his brain did know where his feet were in space. My impression of his proprioceptive placing was that he was just so weak and tired that he was making missteps and kind of crossing his legs over, not because he couldn't feel where they were, but because he was too weak. He did have some documented discomfort in his spine, but it seemed to be pretty well managed. And then unfortunately yesterday, he experienced an acute decline. And if we can get the video to work, we have a great video of it that's really heartbreaking. I suspect maybe he struggled to get up. Something happened, but it appeared from the way that he was walking that his lower back, his sacroiliac region, his pelvis were very painful. And he was walking very abnormally. So he was kind of staggering and crossing over their hind legs. And he seemed like he was uncomfortable, both front legs and back legs. So we met as a team. We discussed his case. We want all of these guys that come through our buyout program to make it to forever adoptive homes. But if you've watched our videos, unfortunately, most of them don't. These are horses that were literally headed for slaughter, and in some cases would have probably been rejected by slaughterhouses because they're in such horrific shape. So we did make the difficult decision to give Remus the last act of kindness. He got a lot of cookies. I'm really thankful that he had a really nice month and a half with us. He got a lot of love and cookies, and he was with friends. And so, yeah, sorry for the sad news if you've been following Remus's story, but we're thankful that he had a soft landing with us and that he had some love at the end of his life. All right, team. What's the plan? Yes. Perfect. I'm gonna try to. Okay. Batman, you're cute. We are gonna swat up your face, my friend. Nope, nope. All we wanna do is put fly spray on you, my friend. So if we went for that instead of this.
How about, we open those.
What do we need to do? If we swing this, we can't swing this over. Yeah.
Okay, just let him go in and sit.
Yeah.
That's my favorite approach. Oh yeah, it worked. There we go.
Boy. Good boy. Very good. See? I know you know this. Here we go. Spin your butt around, please. Good boy. Not everybody's gonna be awful to you in your life, I promise. Look how fantastic this looks, you guys.
That does look good.
Yeah. That Proud Flesh ointment stuff that got donated is amazing. His main presenting complaint was he had flies literally coating his entire face. So I'm just gonna put SWAT all over his face. We noticed yesterday that Batman had a lot of flies on his face and he was kind of standing with his head in a tree. So all we wanted to do today really was just put some fly spray on him. He's very difficult to catch. So thankfully, Sydney's got the rodeo skills and we got him in. His leg looks awesome. It's basically fully healed. It's only like this big. And this was a puncture wound that was like inches deep with bubbling gas. So I'm thrilled about how that looks. Not as thrilled about his behavior, but he was just very recently gelded. So
And we got an arm workout in.
he still thinks that's right. Really all we did was just look at his leg, put some fly ointment on, wound ointment on, and put a fly mask on him. But he's gonna be more comfortable now, less flies on his face, and we all got a good workout.
I want to take a few minutes to talk about a very serious situation and egregious affliction of animal pain here in Tennessee. It's not legal, but it happens, and it happens all the time. And there's so much proof it happens all the time that anybody who denies it happens is really just living in a self-induced cloud of ignorance, because we rescue, and I'm talking obviously about the big lick, we rescue these big lick horses that have open scars, open wounds on their pasterns. We rescue them that are broken down in the back, all from doing the artificial gait known as the big lick. And the only way a horse can be trained to do the big lick is through soring, which is the intentional application of pain to their leg to get them to flinch and do the big lick. We've been protesting for 10 years, and protesting has been going on for much longer than that, but that's when we got to Tennessee and we started fighting this cruelty in earnest. And as you may know, the last time we protested, we were physically assaulted. And that was a horrible situation. It really just goes to prove that people who will intentionally abuse animals have no problem also abusing humans. And we're doing it again. We're hoping that we're safe. We're really doing a lot of things to make sure that we stay safe, but I think that's that's really important is that the animals are kept safe. And unfortunately, this is only going to happen enough people come together to say, this is not okay. So I'm asking you from the bottom of my heart, if at all possible, please join us August 21st at 5 p.m. in Shelbyville, Tennessee. We're going to be protesting big lick animal abuse outside of their celebration. It's their grand finale to the year's showing events, and they try to claim that it's the greatest horse show on earth. They're wrong. It's not the greatest horse show on earth. It's the greatest horse show of pain on earth. And these horses doing the big lick, you can just see in their eyes, in their demeanor, in the way they walk, in the way they look, in the sweat. They'll enter the ring like dry, and they're sweating in like 2 minutes just from the amount of pain and everything that they're going through. And then the blood, I have lots of pictures and video of blood coming off of their legs. It's so much cruelty wrapped up in this little event. And it is little. It's dropping in popularity. People, when they find out about it, they want nothing to do with it. Businesses are pulling their sponsorships, and any business that continues to sponsor this needs to be informed that it's a very poor decision to continue to support and sponsor cruelty to horses. So, again, we're protesting August 21st, Shelbyville, 5 p.m. Please join us. If you can't join us, we're going to be doing a virtual protest, and what that is, obviously, it's not going to be raising as much awareness as being there in person, but it's going to be interesting. We're going to be live, and again, hopefully, we're not attacked again. But this is a very serious issue. This is something that has to be stopped, has to be outlawed, and they have a lot of money and they have a lot of political clout. August 21st, 5 o'clock, Shelbyville. Be there. Join us live. do what we can to raise awareness and put a stop to the big lick animal cruelty.